We are recording. It looks like yes. Okay. So, hi everyone, and welcome to the February PHP webinar. I know I always say that this is going to be a great one, and I'm not saying this because I'm going to be speaking tonight and you're going to have to listen to me for an hour. But this one is a really, really exciting one because we are kicking off the 20th year of public health preparedness at Penn State. And I am so excited about this milestone. We have done a lot of amazing stuff in the past 20 years. And this year, I've got some ideas about how we can commemorate the past 20 years and continue to grow and make our program that much better. So tonight, I'm going to, before a number of you got on, I was telling Gavin that this is kind of a mishmash, but it was done intentionally. So first, I want to talk about the program, where a little bit about where we came from, where we are, some things that are planned for this year. And then I want to talk a little bit about some of the work that I do with the Coast Guard, talk a little bit about what the Coast Guard is and does, some of the stuff that I do, and tie that back in to PHP. So 20 years of public health preparedness at Penn State. So the program started in 2006, and I was not in the first cohort, but I was in one of the first cohorts. I think I started like the second or third semester that it was in existence. So the first director was Rob Cherry, and I am really excited because he is going to be coming and speaking to us in April. I reached out to him and I told him about our webinar series. And as part of the way I wanted to commemorate the 20th anniversary is all of the speakers that we have this year. I wanted them to have some Penn State tie-in. So faculty, students, Dr. Cherry, who this program wouldn't exist without, and he agreed right away. And he is going to come in April and talk about how this went from an idea to a program and all the effort and where this came from. So just as a little look back, when I went through the program, we only had about 10 classes. They only had two per semester. And we've had some people go through our program now, like in a semester or two, because they've taken 4, 5, 6 classes. But back then it was only two. And we had a lot of the same classes that we do now, like 410, 510, and 830. They just looked really different. Conceptually, they were the same, but obviously a lot has changed in the past 20 years. And when I went through, the actual degree that I had that I got, is a Master of Homeland Security in Public Health Preparedness. And as you know, that has now changed. And when you graduate, you get an intercollegiate master. That's what the I stands for, by the way. A lot of people don't know that. I get that question a lot. Master of Professional, that should be Studies, sorry, in Homeland Security. And we have gone just from the original public health preparedness to ag biosecurity and food defense, counterterrorism, cyber threat analytics and prevention, intelligence and geospatial analytics, and homeland security options. I just want to do a quick plug right now. We have had actually one student that was in the PHP option, and he was also interested in the geospatial option. So he went through the PHP requirements, applied to the geospatial, and did those requirements. And then he graduated with his MPS degree with 2 options. And he was the first student that we had that did that. And it worked really well. It worked out great for him. And now he's happy doing geospatial stuff and as his full-time career. We had another student who graduated from the PHP option. So got his degree, walked the whole deal, and then he wanted to come back and get another MPS in Homeland Security and do the geospatial option. And that is logistically very difficult. And we we didn't it that there are a lot more hurdles for that one because the base classes are the same. So um that took a lot of extra effort. So if you are interested in more than one option, there is definitely a way for you to go through you can do more than one. You have to, obviously go through the application process. But if you are thinking about doing more than one option, I would highly recommend that you make that decision and start that process before you graduate. And then that way, like I said, when you graduate, you will still get your MPS degree, but it will just be with public health preparedness and the other option. Um, that was something that we did not know and kind of threw us for a loop. So sharing that one now, so that way, hopefully we don't catch anyone else in a loop. So this is a fun fact that I like to share whenever I can, and I am sure that people get tired of me saying it. But Penn State, we are still the only medical school that offers a Homeland Security degree. It's something that makes our program stand out, and it's something that I am really proud of, and something that you can be really proud of as you take the education here that you get here forward and you take it into your professional lives. So in the past 20 years, we have done a lot, and this list does not capture any professional accomplishments that our faculty have done, um, doesn't talk about anything that our students have done, because those lists would take you could do a number of presentations just on those. I was trying to keep this on one slide. So some of the accomplishments that we have done, we've started this webinar series, which is something that kind of came about at the end of 2018. And I love doing this every month, seeing all the different speakers that we get. And as you all know, we keep these in a library. We use these in the links to the different webinars in our classes. But my goal when I started this was to show the type of careers that fall under the PHP umbrella and just to have a number of people come in and talk about their experiences, build people's networks, and that has proven to be a huge success time and time again. So thank you for coming and making these worthwhile. Thank you for listening to the recordings, and thank you for making this so worthwhile for all of the speakers that we've had. As many of you know, we also have an emergency management club that we got off the ground again, and we are really excited about this one. We have completely established through the university, which was a process in and of itself. But we have some members who have their emergency management certifications and are helping others with we've proposed study groups and mentoring sessions. Similar to the PHP webinars, we have emergency managers come in and talk about the breadth and depth of the emergency management field, but also networking and talking about like best practices as to how they've gotten to where they are, advice that they have, and things like that. So again, that has proven to be an amazing resource, and I hope that we have more students who take advantage of it. We have a great group of students involved in that, and I look forward to seeing how that continues to grow. Book club. So this is brand new well, I guess now it's 2026. So brand new at the end of last year. We've gone through one full book and almost done with the next one. I've got some dates on a future slide. So if you're interested in joining us, you can do that. The book club really just came out of a random conversation with some students. We were talking about some emergency management stuff. Somebody mentioned a good book that they read, and we started geeking out about good public health preparedness and emergency management books. And book club came to be a thing. So again, we've got a great group of people who participate in that, and we've had some amazing conversations. And I hate to keep saying that I'm so excited, but really, it's not a cliche. Being able to watch these things come to fruition and being able to interact with the students and the faculty and our graduates who come back for these things has been so rewarding for me. And I love these opportunities and am always open to new ideas. Over the past few years, we have had some amazing new electives and special topics classes that we have added to the curriculum. And we're actually batting around at an idea for the summer that there will be some announcements about as soon as we lock everything in. I just don't want to speak prematurely, but we have done electives on COVID and on the intersection between public health preparedness and emergency management. And the class that's now 810 was a special topics class. So when sometimes we come up with ideas, sometimes students will say, hey, I wish we had a class on this, and we're able to accommodate. So being able to add new interesting classes is always great. Now we, thanks to the IT expertise of Chulapol, who he should have his own slide because without his IT work, our program would be nothing. But Chulapol has also created a library for student capstones. And we reached out to alumni and asked if we could put theirs in there. And then when you take the capstone class now, completely voluntary, but we ask if we can have a copy of your capstone to put in there. And this is a way to, for current students to see the kind of great work that has come before. They can kind of get an idea for what kind of work has been done and give them like stepping points for ideas that they're having. But also, it's a really great way just for us to capture everything that's been done. Everybody who has gone through our capstone class has done amazing, amazing work, and we appreciate being able to have a library of this. Another thing that is always great is increased engagement with Penn State Health. We have some people from Penn State Health on the PHS Public Health Science faculty, and they have done, they've helped with some of the electives, they've helped with some of our initiatives, they've done our webinars, and that's just always a great, great relationship to have, and they've been some amazing, amazing resources. And another accomplishment that is, it was new in 2025, but we've already started laying the groundwork for 2026. So I am just going to call it an annual virtual mini symposium because that is our goal. Last year was our inaugural one, and we talked about public health preparedness in rural communities. And we did a 2-day mini symposium. It was a couple hours, it was like 3 hours each day. And we partnered with some other schools. We had speakers from all over the country, and it was an amazing success. We had conversations that just they would have kept going for days if we had let them. We were worried about not having enough to fill some of the discussion time, and we had like backup prompts and things like that. And that was the last thing that we needed. We ended up having to cut discussions off because the conversations and the brainstorming was great. So that was something that we definitely wanted to do again and to we had a couple of different ideas about how we were going to do it. But last year, like I said, we did rural preparedness. This year, we are taking more of a biodefense take on it. So we are going to announce the dates for that. Our goal was January, but that obviously did not happen. I have to get the planning meetings back on track for that because I kind of stumbled with that one. But you will see plenty of advertisement when we do the biodefense one. And when we do it, it will be free for Penn State students. So there will be no charge for you. So if once once those announcements start coming out, I would definitely recommend attending because it's last year's was great. And with the people and the feedback we've gotten for this year so far, I have no doubt that this year is going to be just as good. Okay, so I keep talking about the 20th anniversary of our program. So there are a number of things that we are interested in doing as part of the commemoration. And if you've got ideas, please feel free to let me know. So as I mentioned, want all of our webinar speakers this year to be internal from Penn State and affiliated with the program somehow. So I've gotten some great feedback on that. So I have no doubt that we will have another great lineup. I know I say it all the time that we have great speakers, but I honestly mean that. We do. Okay, a little side note. People will sometimes ask me how I get the speakers. And when a lot of the speakers I get, I just cold call from, well, I guess cold email from LinkedIn. And I explain, like, hey, I'm with Penn State and I have this amazing group of students. And this is our goal, just to show them all the different types of public health careers and how you got there. And I get responses from almost everybody that I email, and almost everybody has been more than happy to come speak. I've only had a couple people that weren't able to do it. But when people hear that this is a webinar for public health students, they are more than willing to take time out of their evening and speak because they think A, that it's really important, and B, they love being able to help share the information and the knowledge. So that is, not only do I love the outcome of the webinar series, but seeing the kind of camaraderie in the field and the type of people that are just so willing to give their time has also been great. Um, and I do need another word, I know that. So we have done clothing sales. We've got our PHP swag. I'm wearing my sweater right now. We do them periodically because we need a minimum order. There is a retailer in Hershey that has the rights for the College of Medicine logo. So in order to order from them, we open up an online store and we need to hit a minimum. So you go in, you can buy whatever you want, pay for it yourself, have it shipped to your house. And we just need to hit a minimum in order for them to execute the order. So that's why we don't do it all the time. It's not like it can be an ongoing thing, but we definitely want to do one of those. We also have PHP mugs, and I meant to bring mine over so I could show it to you, but that was something else that we were going to do. Similar idea, they come from the same company, so we would throw those into the online store, and people can go and order them. They'll come right to your house. Warning, it does take a little bit of time because they can't execute the order until the store closes, but they've got some amazing stuff, so it's definitely worth it. I mentioned that we are working on an elective for the summer, and we will be sharing those details as soon as we can. Biodefense Mini Symposium is something I just talked about. And we are looking into some more things to do for the 20th anniversary. If we have students coming in May to walk in commencement, I haven't gotten a list of the people that are coming yet, but that was also, if we've got people that are going to be coming in May, we could do something then. That's always something that we try to do if students are interested. So always be on the lookout for these things. And we would definitely like just to take the time to appreciate the past 20 years, thank everyone who has been such a major part of making this program so amazing, and lay the foundation for the next 20. Okay, so I mentioned that there would be a future slide with upcoming dates. So we do these PHP webinars on the first Wednesday of the month when there are classes. So we skipped January because it was still winter break. We're going to go until May, and then June, July, and August we will skip, and then we will start up again in September. But next month, Dr. McGregor Skinner, who we have with us tonight, is going to be speaking. If it wasn't for the huge winter storm that we got, you would have gotten him tonight instead of being stuck with me, but he will be speaking next month. And then in April, as I mentioned, we are very excited to welcome Dr. Rob Cherry back. I literally have not talked to him in about 8 It's been at least 15 years. And when he saw my email and knew what it was about, he jumped on this. So I was really excited to be able to have him come. Book club, I mentioned, third Monday of the month. All of these things are at 8 p.m. Sorry, I forgot to mention that. Um, February, so in 2 weeks, we are going to finish up the hot zone and then we're going to go right into the big one. And all of these we have meeting invites for. So if you're not on them and you want to be, just shoot me an email or put it in the chat and I will add you. And then the Emergency Management Club, those are the second Tuesday of the month and those go year round. So we also have a link for the actual club if you want to be on the official roster. So I can share all of those things if you want. Just let me know. All right. Okay, so I am going to now transition from the Penn State part of this presentation to a little bit about the Coast Guard, what I do in the Coast Guard. This logo over here is obviously the Coast Guard shield. This one over here is specifically the Coast Guard Reserve because I am a Coast Guard reservist. So let me just switch PowerPoints. All right, Gavin, can you just give me a thumbs up if you can see that?
Yes, Jem, but put it in presentation mode.
Wait, can you see what is the Coast Guard and what do we do? Oh no, hold on.
I can see all your slides on the side.
All right, can you see that now in presentation mode?
Yep, that's perfect.
Okay, perfect. So I'm going to start just by talking a little bit about what the Coast Guard does. I get that question a lot, both when I'm doing joint, I've been stationed at a couple of joint bases, which I will talk about, but what is the Coast Guard and what do we do? So it is one of the six branches of the U.S. military. Six has been updated because we've got Army, Navy, Air Force, and Marines, Coast Guard, and Space Force. So we are the second smallest branch behind the Space Force, um, only military branch in the Department of Homeland Security, and Coast Guard is roughly the size of the New York City Police Department. So that will become even more of a surprising number when you see the breadth and the depth of what the Coast Guard does in a few slides, because New York City Police Department has the same number of people for city, and Coast Guard has global operations. So definitely small but mighty. Coast Guard has 11 major missions. Many of them have a humanitarian component, and you can see here. Um, Search and rescue is obviously a big one. Um, Ice operations, especially with everything that's going on in the Arctic. Environmental protection, you see a lot on the news. Right now, there is a big emphasis on maritime border security, so you will see that. Law enforcement is always an interesting one because the Coast Guard has law enforcement authorities that the other branches of the military do not. Defense readiness, you've also seen that one in the news a lot lately, and drug interdiction. So Coast Guard does a lot and they do a lot of varied missions. But I've been in the Coast Guard almost 19 years and my husband was in when before I joined. So I've been exposed to the Coast Guard closely for probably about 23, 24 years, and it still amazes me everything that gets done with with the number of people that we have. Okay, I will say I did blatantly steal this from a recruiter. These are just some cool facts about the Coast Guard, and I'm sorry that it is kind of small, but on the average day, Coast Guard will, again, I'm not going to read all these, but Coast Guard will save 12 lives, do 44 SAR cases, investigates 34 pollution incidents, seizes over 1,000 pounds of cocaine every day. 15 fisheries boardings, which is another thing that the Coast Guard does that a lot of people, especially uh, don't know about. Services 60 buoys and fixed aids to navigations. escorts 9 high capacity passenger vehicles. So when you see cruise ships leaving the port, they are typically escorted by Coast Guard small boats. Um, a big one is this facilitates movement of $12.6 billion of goods through the nation's maritime transportation system, and that's $12.6 billion a day. So Coast Guard is very busy. Fun facts about the Coast Guard. It was founded by Alexander Hamilton in 1790, which means, much to the chagrin of some Navy people out there, that it is the oldest seagoing service. And it was the only armed force at sea until the Navy was founded in 1798. And Coast Guard has proudly served in every one of the nation's conflicts. And it's pretty interesting if you look into Coast Guard history to see the role that they've played in World War II and Vietnam and in a lot of things that you wouldn't think that the Coast Guard would have participated in. D-Day, there's a really famous picture of Marines in World War II thanking the Coast Guard. Um, we have one coastie who was a recipient of the Medal of Honor, and he had died helping save the Marines. So Coast Guard was among one of the first agencies to respond to the World Trade Center. We've Coast Guard's produced 3 astronauts, and also over here, the middle picture here is the Coast Guard cutter Eagle, which is a training vessel that they have up at the Coast Guard Academy, and that used to be a German ship that we took as a prize during World War II. But if you go to the Coast Guard Academy, then you typically spend, which I did not do, but you typically spend, I believe it's at least one summer for the Eagle. So there are more than 500 Coast Guard units in total. They're all over the domestic U.S., Alaska, Hawaii, and we also have a number of overseas units, which a lot of people don't realize because they think that we've just got them on um, the continental U.S. coast. But not only are they all over the country here, but we do have units in Bahrain, Europe, Japan, Singapore, and we've got units of all different sizes, which I know that 200 people at some of our largest units is nothing compared to a DoD unit, but for the Coast Guard, that's pretty big. Half the units are ships, and the rest are shoreside land units. We also have a number of deployable specialized teams. You've seen them in the news lately. So again, very, very wide variety of job specialties, pay grades, ranks, and missions. So I mentioned that we do have a number of bases all across the U.S. Obviously, they're concentrated on the coast, but we do have bases on the rivers, the Great Lakes, all over. And then me personally, I started at Sector Long Island Sound, which is in New Haven, Connecticut. So I kind of worked my way down the East Coast. I went to Coast Guard headquarters in the Office of Counterterrorism and Defense Operations. The name has since changed. And now I work at Coast Guard headquarters as a contractor in the Office of Specialized Capabilities on the Countering Weapons of Mass Destruction team. After I left Coast Guard headquarters, I was a Lieutenant JG at that point. I got promoted there right before I went to Sector Maryland. I did incident management and then I did response there. Then I went to Joint Forces headquarters in the National Capital Region where I made 04 and I was the reserve liaison to the Maritime Domain Officer. Did 3 years there, and then I went to Sector Virginia where I did emergency management and force readiness. And then I was the response department head for the rest of my time there. And then left Sector Virginia and I went to Joint Staff South where I did planning with the Coast Guard unit, but then joint responsibilities included being the deputy of the Reserve Joint Exercise Division and also the reserve liaison to the Special Operations Command desk officer. These were all great tours. I don't think I could pick a favorite one. They all definitely had amazing perks. And then after I left Joint Staff, then I now drill down in South Carolina. I'm the senior reserve officer down in Charleston. So our sectors are those are your shoreside units, and they've got response departments, and under response falls incident management. So those are the ones that are going out when there are spills or sheens or things like that. Enforcement, those are our law enforcement people. They will do boardings, they will escort ships that we've got some or ships or boats that we've got concerns about. And they are that maritime law enforcement presence. And response is also responsible for the small boat stations, which is what a lot of people think of when they think of the Coast Guard. Those are the small boats that will go out and do the SAR cases. They are the ones that are interacting with the public to talk about safety. So that falls under response. Um, Sectors also have prevention departments, and those are the people that inspect containers and they make sure that everything is safe. So that way, hopefully, we don't have to respond to things because we've prevented any of the problems. Emergency management and force readiness is another department at the sector. The Coast Guard is huge into ICS. I know we've talked about that in a number of different capacities, but Coast Guard uses ICS a lot. And these are also the people that make sure that all of the coasties are ready to go respond and to do their job. So they are the ones that are tracking medical readiness and qualifications and things like that. Um, Intel, self-explanatory. And sectors also have a logistics department, which is your admin, your storekeepers, and things like that. So Sector Charleston has all of these in the active duty component, and they also have reserve counterparts. And in my role now as a senior reserve officer at the sector, I am in charge of all of the reservists filling all of these billets at Charleston and also our 4 outlying stations. Okay, so another thing that I did want to talk about is Coast Guard and public health preparedness, which is why we are all here. So Coast Guard has does the Coast Guard does do a lot with public health, even though it is not one of those statutory missions that I talked about um, at the beginning. So, as I mentioned, Coast Guard falls under the Department of Homeland Security, and it is oftentimes used as like a the DHS quick response force. So, when FEMA needs assistance, when DHS needs assistance, the Coast Guard is often called in to help with some of these responses. So, when FEMA was establishing the mass vaccination sites, we had a lot of Coast Guard reservists that were active duty as well. But I'm speaking from the reserve perspective. We had a number of reservists that were activated to help establish those sites and to help with the logistics behind it. Um, when Ebola, the 2014-2015 Ebola outbreak, we had Coast Guard medical personnel in American airports that were helping with temperature screenings from people that were coming in with from international flights. And Coast Guard and PHS wear the same blue uniform. You just have to look at the name tapes. So I'm guessing that when people saw people in blue scanning people's foreheads, they probably assumed that they were public health, but there was a good chance that those were coasties that were doing that. Coast Guard works with the CDC to help enforce maritime quarantine stations because the Coast Guard's got the LE authorities and capabilities. We work with industrial hygienists. We have industrial hygienists, and in the Coast Guard, we work closely with them to make sure that the different things that we are doing are keeping our members safe. And they also will help us with different policies and things like that to keep the greater maritime infrastructure safe. Um, Coast Guard does a lot with hazmat. Both, I mean, my office does um, does CBRN response, but we also have the National Strike Force that responds to hazmat incidents both on the water, and they are trained and equipped to also respond anywhere in the country if they are needed. So um, even in places that you wouldn't necessarily think you'd see the Coast Guard, like the East Palestine train derailment, we had our National Strike Force there. And as I mentioned, the Coast Guard works a lot with the Public Health Service. We don't have, actually, I don't want to say we don't have. Typically, we did not have our own medical officers. So all of our Coast Guard medical officers would come from PHS. I believe we have started sending our first few people to medical school now. So now we will have like dedicated Coast Guard doctors. But industrial hygienists we will get from PHS, doctors, PAs, things like that. So when somebody is serving in the public health service and it's time for them to PCS or change their station and they put in their dream sheet of billets of where they want to go, it can be a mix of like Indian Health Service, the Coast Guard, and different PHS billets. So we had a webinar from actually it was a graduate from our program who was a PHS officer who worked with the Coast Guard for a number of years, and then he ended up retiring from the Coast Guard. So yes, we do share resources and work with PHS a lot. So I believe that was my last slide. Yes. Okay. So sorry I went through that quickly, but I knew I knew there was a lot on those slides. So um does anybody have any questions about Coast Guard, about the program? Hey Gavin, looks like you're
Hey,
unmuted.
hi
Oh,
Jen.
hey
Oh,
Gavin.
I the question I was going to ask is more about the Coast Guard and the Ebola mission, and I know Gavin's here too, and I enjoyed learning with in his classes about his missions in Africa. I can't remember if I've seen pictures of what you worked with the Coast Guard, but I thought there was something about medical transport of Ebola patients, maybe with Coast Guard helicopters or something that I didn't know if you I remember maybe there was an article or something, but what
Hold
can you
on
share
one
about that?
second. There is you, you, I, where did it go? Screen share. Okay, here we go. Okay, so yes. So the Coast Guard developed a system for evacuating infectious or contaminated patients as a result of the Ebola crisis. So this is what it looks like. So during the Ebola crisis, the Coast Guard was asked to transport a patient who they suspected was an Ebola patient, but they didn't know. And the Coast Guard had some concerns, rotor wash, all of those sorts of things, and potentially infecting an aircraft and an aircrew. So we ended up ultimately developing this portable isolation unit, which we can use to transport patients. It is a fully contained, I'm gonna say a bag, but it's like a sleeping bag, and it's got a papper on it. So somebody who is suspected of having an infectious disease um, can go in here. They can you can zip it up. the outside can be decontaminated, and they have a PAPR that will run for 4 hours. So we can transport them off of it's in a Stokes litter, and the initial idea was that they could be medevaced on a helicopter, but it doesn't have to be. So you can use this on a small boat, you can use this in on a helicopter, and the idea is that the patient would be delivered to to a like an ambulance. They would get the Coast Guard would get them back to shore, meet an ambulance. The ambulance would take the patient in the PIU to the nearest facility that can accept them. And then at that point, when the hospital here, are you trying to read it or see it, Gavin?
Just to see it, Jen. I know what it
There
is.
you go. Um, and then at that point, when they get to that receiving facility, then they would be removed from the PIU. But yep, that is what you were thinking of.
And you're right, Kevin. These do have a name, but we just said put them in the burrito.
Oh, I like that.
What was this used prior to Ebola for any other purposes? What was there any new technologies that they had to bring to this, or
This was developed for us as a result of Ebola. So no, to answer your question. And also we specifically called it a portable isolation unit, not a patient isolation unit, because unlike some of the things that are used by DoD, um, once the bag is zipped for us, it's zipped, and we don't have the ability to give any sort of medical care. So this is just a transport device.
and who owns those or who has those? Are they like in like a national supply readiness for I can they and I'm sure they could be used for something other than Ebola too for isolation.
I know the Coast Guard has them, but I imagine that I imagine others do, but I can only say that the Coast Guard does. Actually, here DoD has much larger ones. Um, this is so this is their transportation isolation system in a C-17. As you can
Hmm.
see, it's a little bit. I mean, C-17 is
Mhm.
bigger than what
Oh
the
yeah.
Coast Guard has, so obviously this is going to be bigger.
Hmm.
And it's interesting, good point, Kevin, because disasters, emergencies accelerate innovation and technology. And so these things came out pretty quickly. And then we all went, oh, do they work? Which we had to test them. And so a lot of the photos Jen's showing is those that have been put through tests in, I think the date is 2019, but they're real. This stuff now is fantastic. Jen, with what you outlined for the Coast Guard still being in Homeland Security, as you look into your crystal ball, where do you think where do you think Coast Guard would go to? Will they stay in Homeland Security, or will they go over to somewhere else?
I've heard a lot of arguments pro and con. One concern about, I mean, one thing that people ask a lot is why Coast Guard doesn't fall under DoD, because a lot of our defense missions and border security and things like that. And the big answer to that one is that if we were to go under DoD, then a lot of the unique authorities that the Coast Guard has would be lost. So, like right now, for example, the Coast Guard does have law enforcement authority, and the Coast Guard can also change hats very quickly. Like if a police officer on land, are if they go to your house and they're looking for something and they see something else, they need to go get warrants. But the Coast Guard, if Coast Guard is doing like a safety boarding, and they board your vessel because they want to make sure that you have 5 people and 5 life jackets. And if you pull out a life jacket and a brick of cocaine falls out, then they can automatically switch hats and it becomes a law enforcement mission, and they can, they can arrest people, and they can do all that. So those unique authorities would be very difficult to maintain in DoD, if not impossible. So that's a big reason why people don't want to go under DoD. I've heard that Coast Guard should go back to transportation. Heard it should go back to Treasury, which is where it was years and years ago. But right now, right now, it sounds like it's going to stick around in DHS. And one thing that's really interesting about the Coast Guard right now is that I guess it was 2, 3 months ago now when Donald Trump signed the big beautiful bill. So the Coast Guard's annual budget is about $2 billion a year, and the Coast Guard is often the DoD gets a lot more money than the Coast Guard does. And that was one reason why people wanted the Coast Guard to go to DoD, because we could hopefully get more resources, more money, everything like that. So Trump signed the big beautiful bill, and it gave the Coast Guard an influx of $25 billion. So a one-time payment that is 12 times our annual budget. So right now, the Coast Guard is undergoing the biggest reorganization in 100 years. We are doing a lot of catching up that we just haven't been able to do. And we're also looking a lot towards the future and addressing those threats that we are in a position to right now. So the next few years of the Coast Guard are going to be very, very interesting. And it is one of the biggest, quickest changes I've ever seen in the Coast Guard.
Oh, thanks. I didn't know those budget numbers. It's interesting.
Yeah, crazy. And we heard them so many times because it was like people didn't believe it. So when we would be getting briefs and things like that, people would repeat it multiple times because this is not the way the Coast Guard normally gets things.
So
Normally,
does that include icebreakers? I know maybe I think it's two. I've seen one of them when it was in Seattle, the Polar Star, I think.
mhm.
But I was a little surprised Coast Guard had two, but I know they wanted more. I think China and Russia have 17, but hopefully that money includes some new icebreakers.
Yes, I believe the icebreaker. I want there. It is in there. Icebreakers. I want to say 6, but I wouldn't swear to that. That's definitely something that was being prioritized, though. Coast Guard. Okay, so according to the Coast Guard news release, the funding will allow the Coast Guard to procure an estimated 17 new icebreakers, 21 new cutters, over 40 helicopters, and 6 C-130s, while also modernizing shore infrastructure and maritime surveillance systems. Also strengthens the Coast Guard's ability to counter drug and human trafficking, conduct search and rescue, enhance navigational safety, and enable maritime trade. So 17.
That's good.
Yeah. It's they're like I said, a lot of changes very quickly. Like they're restructuring a lot of the offices at Coast Guard headquarters, um, just making the goal is to make things more flexible and just more able to address the changes and challenges that we're continuing to face. So um when I interview people who want to join the Coast Guard now, I ask them if they think that flexibility and adaptability are are traits that they think that they can excel at, because that is definitely something that you need right now in the Coast Guard. Anybody have any questions? I know we have a couple other people on the call. All right, and I am also okay, double checking the chat. I can send oh that is what I wanted to do when I had everybody here. I'm also going to share the okay, this is the link for the emergency management club, if just that way people have it again. The person who's on the iPhone, it looks like you unmuted. Did you have a question? Okay, no worries. All right, well, if nobody has any more questions, you can have 5 minutes of your evening back. So, like I said, we've got emergency management club coming up next week, and then book club coming up at the end of the month. Oh, you're welcome, Molly. I did send an email out to the book club people to see if we still wanted to have it on the date that it's scheduled for, because that is President's Day. So if people have holiday plans, just if you are interested, just check your email, because there will be either a confirmation email for the 16th or a change of date email. But that's coming up. And then March 4th, Gavin is going to be talking. And what is the title or the gist of your of your talk going to be?
We're talking about taking what you learn in the classroom to crisis.
Perfect. That is definitely appropriate right now.
So I'm going to go over a few things that some of the students have done and what I've done and how we've taken what we've learned and applied them to real world experiences.
That's awesome. Great. I'm looking forward to hearing that.
Just on
And
that,
again, I know I say that all the time.
just on that, Jen,
But I really do.
being 20 years, do we actually have a list of students that have gone through the program in that 20 years that
We do. I I am not on that list. So I am just curious how far back it goes. So I do have in my email, it's maybe like a year or so old now, but I do have a list of students and their capstones. But the reason that I reached out to Tulipole and wanted to do this library is because up until this point, it was just literally a list of names and a list of titles. And if you were a student now, like, oh, that person's capstone looks amazing. That's exactly the topic that I want to work on. Like, it's not like I could say, oh, here, click this link and read what they did. So that's why I really wanted to have a repository where we can put all of these things. So kind of to answer your question, it's as complete as it can be, but and not that I need to be on the list to make it complete, but just because that was I was looking for a couple names that I specifically knew were earlier on, and I wasn't seeing them. So it's at least a good start.
no. So is that list of the capstone, is that live now? Is that something we can share in our courses? Does it exist?
Let me find it.
I think it'd be fascinating.
Yeah, I will. Let me find it, and I
It's I think Jen, it's in I'm in the research 594 class. It's shared in there. I'll see if I can share it with you. I
perfect.
can't remember if it's an Excel spreadsheet, but there's links to it. So you're right. It's what they've given us is a couple full examples of research projects and then a big list of titles and what they were in the year. But
I
I
just
can send
sent
that
it
to you.
to chat. There's a link in chat.
Oh, okay. Yeah, let's see. I'll see if I can do that.
The link that you just gave us, Tulipole, is that for that's for the library that has the full text ones, right?
Yes.
Okay, perfect.
Yeah,
Is
I
it the
tried
one
to.
that that's the one that you're working with me? I don't know if that's something that we are using it right now.
I am hoping that I'm gonna check it out. I have to making me sign in. You should be getting more at the end of every semester. But I can make sure that we get you any of the ones that we've missed. Yeah, so
Wow, 200.
okay, so yeah, so Tulipol's got all of the titles, and then the ones that we've got the full text for, they've got download links.
That's 217 entries there, Jen.
Yeah, we've had it,
Wow.
and it looks like it goes back to
Well, that's impressive.
2011, and actually a lot of the older ones there are we've got downloads for. Yeah, it's crazy to look back at these and to see some all of these projects that have come through. Just a little light reading for you if you want to go through 20 years of capstones.
Oh, I think it's just fascinating just to look at the titles.
Yeah,
Wow.
a lot of great work that's been done.
Yeah. Very impressive.
Yes.
We'll,
All
we'll,
right. Well, again, hopefully we will see people at the emergency management meeting and the book club. But if not, I hope to see you back here this time next month for Gavin's talk. Right. Have a great night, everyone. Oh, did you have something, Gavin?
No, thanks, Jen. That was
All right,
great. Enjoyed that.
great. Thank you.
Thanks, everybody.
Have a great night. Bye, Kevin. Thanks again, Chulabol.